इट्स अ स्टेप बाय स्टेप मैनर, नॉट जस्ट बाय स्टार्टिंग कमिंग टू द एंडिंग पॉइंट कि हाँ ये कंडीशन है तो इसका बस रिजल्ट चेक कर लो या इसका हमें रिहैब पार्ट चेक कर लो, नॉट जस्ट अबाउट दैट, ठीक है। एविडेंस बेस्ड प्रैक्टिस इट इन्वॉल्व द लाइक होल पैरामीटर, लाइक उस कंडीशन के बारे में हम लाइक स्टार्टिंग टू एंडिंग हम क्या स्टेप बाय स्टेप मैनर से किस प्रोसेस के साथ हम उसको कंसिडर करेंगे। सो दिस इज ऑल अबाउट दैट। आई थिंक अगर आप इस कोर्स को ज्वाइन करोगे तो ये मैं लाइक आपको इंश्योर कर सकता हूँ कि आपको जो अगेन बार बार हम बोलते हैं कि हाँ ये लिटरेचर में लाइक ये काफी कन्वेंशनल हो चुका है, ये जो भी हम टेस्ट कर रहे हैं ये अब उसकी स्पेसिफिसिटी नहीं है या सेंसिटिविटी नहीं है या ये कंसिडर ही नहीं करते, ये रिजल्ट ही नहीं देगा, वो लाइक आपको अप टू 95 टू लाइक 100% तक कंसिडर हो जाएगा। आपको क्लैरिटी आ जाएगी कि हाँ ठीक है हम ये 5-6 साल से ये सब करते आ रहे हैं, बट अभी इसकी लाइक इतनी हम रिजल्ट नहीं देख सकते हैं, लाइक ये कुछ और नया आ चुका है या कुछ हम इसमें इवोल्यूशन हो चुका है। तो स्टेप बाय स्टेप मैनर के साथ हम वही कंसिडर करेंगे। सो आई हैंड ओवर टू द लाइक डॉक्टर शिवम फॉर फर्दर लेक्चर।
So thank you, Happy. Thank you for your brief introduction about our course. So this is a course where we will study upper limb in indefinite time. My name is Shivam. Again, I'm introducing myself. So this is Movement Lab. So in elbow, we'll study these 8 conditions. This is the most common conditions we see in elbow and we see in our clinics. So basic anatomy, I don't want to touch basics of anatomy and biomechanics, but for me and for you, the things important here are the ligaments of the ulnar side and the ligaments of the radial side, very, very important. The olecranon, okay, the radial head, and definitely the shaft here also, where of the humerus. Some ligaments, again, I said, if we dissect it down, we see that the ligamentous complex, जो ligaments हैं वो पूरी तरह elbow को cover कर रहे हैं, and they are binding with the fascia also here, they are binding with the muscles also here, okay, and each ligament has a specific role here, and most of us know the main function of radial collateral ligament, for example, or we say ulnar collateral ligament and all. Okay, the annular ligament is very important in terms of our joint stability. So basically, joint, I always say is that the passive soldiers are the ligaments. So these are the passive soldiers which provide you stability when your muscle or the neuromuscular control is less or not very efficient, or there might be some injury to it, or in cases of fatigue also. So evidence की बात कर रहे हैं. Okay, I want to help you out with this picture of an old man. So a man with Alzheimer's forgot that he's blind and recovers vision partially. Okay, this is a very sarcastic meme I found out, and I think so we can rely on this. Is my screen visible? Okay.
Yes, sir.
So level of evidence we rated from 1 till 5. Okay. हाँ, एक बात है कि बीच में कहीं भी कनेक्शन लॉस हो या आवाज ना आए हो तो प्लीज लेट अस नो. So 1 to 5 we see that there is evidence from high quality diagnostic studies, review of systematic reviews, RCTs. Okay. As we go down, we know that the evidence, if it is at number 1, it is the most reliable one, and when we go at 5, it is not very much, in relation to the literature. It's like कि हाँ किसी ने अगर बोल दिया है, किसी ने उसको publish कर दिया है, doesn't mean कि वो that would act as a evidence for you all guys. Okay, it is just that कि किसी ने बोल दिया उस बारे, and we are trying कि उसको पढ़कर हम ये बोल पाए कि हाँ इसकी बात सही है. तो सही है या नहीं है वो हमें हाई क्वालिटी स्टडीज बता देंगी इन फ्यूचर टाइम. अगर उस पर नहीं है, अगर ऐसा नहीं है तो डेफिनेटली we need to look over the other studies here, like for example the systematic reviews, the prospective studies, improper randomizations or normal clinical trials, some retrospective studies, some cohort studies. Okay, so these studies will help us understand when there is no RCTs or meta-analysis. And here I also want to tell you that if you try to, you know, consider my point of view here, that अगर मैं आपको कोई चीज बता रहा हूँ तो try to take it as a neutral statement, because none of these statements are from me. It is from the literature, and the literature is followed by the world. Okay, so अगर किसी का भी मानना है कि एक्स वाई जेड चीज के लिए ये सही काम करता है and the evidence says it doesn't work like that, so it is a little less credible as compared to the literature. Okay, so lateral elbow tendinopathy. This is the most common condition we see in elbow, and I want to also put that कि इसके और भी नाम है बहुत सारे, and maybe some of might be new to this, पर अगर मैं एक टर्म बोलूंगा आप लोगों को कि इस कंडीशन का नाम ये भी है, यू रिकॉग्नाइज इट, सो दैट इज कॉल्ड टेनिस एल्बो. तो पहला जो पॉइंट है इस पूरी कंडीशन का, दैट इज टेनिस एल्बो lateral epicondylitis term has been discarded now. It is known as lateral elbow tendinopathy because पूरा जो ये कंडीशन है इट इज बिकॉज ऑफ अ टेंडन, एंड टेंडन के हिसाब से अब इसको ट्रीट किया जाएगा, नॉट समथिंग लाइक बोन पर अटैचमेंट है तो बोन के हिसाब से हम इसको ट्रीट करेंगे, और वी आर ट्रीटिंग दिस लोकल साइट ओनली विद अ लॉट ऑफ थिंग्स. ओके, as you can say that Scott et al told that the current accepted description is lateral elbow tendinopathy. As I always say, every statement I'll quote is from the literature only. अगर मेरा कोई पर्सनल स्टेटमेंट इसमें होगा तो प्लीज consider that कि वो मेरा पर्सनल स्टेटमेंट है, it could be wrong, it could be right. Okay, complaint and history. Okay, so pain with resisted extension, gripping activities, decreased grip strength, point tenderness at ECRB tendon. So ECRB tendon we all know, and it is attached to the lateral epicondyle. Okay, so it occurs in repetitive upper extremities. Okay, and like for example computer use or heavy lifting or forearm pronation supination, repetitive vibrations. So apart from just the athletic population, नॉन एथलेटिक पॉपुलेशन में ये कंडीशन देखते हैं. इट्स नॉट जस्ट कि टेनिस जो खेलता है उनको होता है, ऐसा नहीं है बिल्कुल भी, उनमें भी होता है जो ये जॉब्स करते हैं रेगुलरली. ओके, बट सम ऑफ यू माइट आस्क मी, सर या शिवम, कि मतलब हम भी तो करते हैं या हमको क्यों नहीं होता है ये, एंड दिस इज वन ऑफ द मोस्ट कॉमन क्वेश्चंस कि सबको क्यों नहीं होता अगर ये सब काम सब कर रहे हैं तो. या दैट्स अ गुड क्वेश्चन. So it is elbow tendinopathy. It is 5 times more predominant in the medial aspect. Okay, and sorry, in the lateral aspect, and it is affects 1 to 3% of the population. Those with 35 to 50 years old, and if it is more than 35, it is important to consider more other uh, factors or diseases like uh, something more than arthritis or cervical pain. And if it is for less than 35, we can say that it is something growth plate disorder also could be a possibility. Okay, so very important slide, LET risk factors. So lateral retinopathy has been abbreviated now as LET risk factors. So you can see that risk like picking up high kg of load, 1 kg heavy loading, and 10 times per day, more than 2 hours per day. This is one of the common factors which we see in heavy workers. When we talk about the overall risk factors, Andrew in the year 2020 said, female sex is more affected. Dominant side involvement is there, manual labor is present, and ipsilateral rotor cuff tear. So the same side का rotor cuff tear है, तो there are chances that the patient might develop lateral retinopathy. And then we say female gender, smoking history, manual labor, hypercholesterolemia could cause ALI. And also, if a patient is taking a treatment of statin, which is used in various heart conditions and blood conditions, it can also lead to development of ALI. Okay, so it has been just recently reported in the 2023 only in Journal of Hand Therapy कि ये जो फैक्टर्स हैं ये भी lateral epicondylitis और lateral elbow tendinopathy को प्रमोट करते हैं. Another risk factors for athletes, mostly of racket sport are, 50% of the population affected. Poor swinging of technique, heavy racket, incorrect grip size, high tension of the string. So अगर कोई पेशेंट आप देख रहे हैं तो ये क्वेश्चंस अपने दिमाग में जरूर रखना है कि ये फैक्टर्स तो नहीं है. जरूरी नहीं है कि पेशेंट बोले कि ये सब चीजें तो सेम थी. यू हैव टू आस्क दैट कि आपने बीच में इसको कहीं चेंज तो नहीं किया है. अगर चेंज किया उसके बाद सिम्टम्स आ रहे हैं देन इट डेफिनेटली मींस दैट देयर इज समथिंग गोइंग अराउंड. This paper is quite old. It is in 2007, but it is a good paper. Okay, so it is published in British Journal of Sports Medicine. That is the topmost journal of sports medicine in the whole world, BJSM. So when we talk about the diagnosis now, okay, so we have seen कि किन लोगों में ज्यादा होता है, क्या risk factors promote होते हैं, what is the racket sport, how different factors of racket can affect it, and some orthopedic tests, middle finger extension test, Mills test, grip strength test, Cosen's test are one of the most common tests which we use to diagnose this condition. Okay, कुछ लोगों को ये टेस्ट नए लगे होंगे, कुछ लोगों को ऑलरेडी उनमें पड़े होंगे. The main important thing right now is if these diagnostic tests are already, very reliable to look upon. जो सारे ये टेस्ट हैं इनका जो डायग्नोस्टिक कैपेसिटी है, डायग्नोस्टिक रिलायबिलिटी है, दैट इज लेस. ओके, पर जो कोजेंस टेस्ट है और जो ग्रिप स्ट्रेंथ टेस्ट है, दीज आर नॉट वेरी रिलायबल क्योंकि इन पे स्टडीज कम हुई है. पर लिटरेचर कहता है कि they are very sensitive to this condition. Okay, but we might need more studies in the future to actually say that this is the concerning test which we should use. So overall we can use all of these tests. Okay, but when we talk about what good tests are there, Cosen's test is very important, grip strength measurement is very important, and also when we say that ultrasound imaging kar lenge, MRI kar lenge, that depends upon the tissue abnormality. Okay, and the clinical test of LET is based on the presence of pain in the lateral aspect of the elbow, radiating to the forearm, tenderness of the lateral epicondyle. So these are the hallmark features of this condition. This condition has this typical representation. Book के हिसाब से, paper के हिसाब से, this is the typical definition. So what we should keep in mind when we are diagnosing this condition: lateral elbow pain have with or without resistance, radiating into forearm, no history of trauma, occupational work history, as we said, कि manual labor ज़्यादा है उसका, age less than 50 years, no cervical spine. So if these things are picking up in a patient, then that means it is mostly a LET. Different conditions, which can be relatable to LET are these. I won't go into detail because this is all we will be discussing in the main lecture. But yeah, this is how the differential we will see. Now the management part. This is the as per the hierarchy I have set it. कि इस हिसाब से मैं चलूंगा as per the literature of course. पेशेंट एजुकेशन सबसे ज्यादा इंपॉर्टेंट चीज है इसमें. मतलब पेशेंट को उसकी कंडीशन के बारे में बताना बहुत ज्यादा जरूरी है. उसी कंडीशन को हम कैसे मैनेज करेंगे वो बहुत ज्यादा जरूरी है. कंडीशन में क्या हो रहा है बहुत ज्यादा जरूरी है. Many of us say that you do the repetitive activity, that's why you have a pain in your lateral elbow. So as we just got to know about it, it is a tendon issue. So we need to tell the patient that it is a tendon issue first of all. It's not a bone issue. Patient complain करेगा मेरे bone पे pain है, तो he thinks that कि मेरी bone में दिक्कत है, पर नहीं. It is the attachment site of a tendon. Okay, this is the point where it is affecting. Second is the exercise and load management. Okay, so load management has been reported to be the most efficient and most important management intervention in tendinopathies. और टेंडोनोपैथी चाहिए एल्बो की हो या रिस्ट की हो या एंकल की हो या नी की हो, any tendinopathy should be encountered with load. And then the last and the most lowest of priorities of eye is the manual therapy, electrotherapy. So you can see the trend here. Mostly in our settings, what we have learned is, some of us might have learned that electrotherapy, ultrasound लगा दिया, मसाज कर दिया, डीप टिश्यू फ्रिक्शन मसाज कर दिया, ये कर दिया, वो कर दिया. These are all very low priority things. It's as per the literature now and as per how our cities are designing themselves. So while preparing for this PPT, I got this a beautiful paper. Okay, this is the paper by Lucado. It came in 2022 only. It is in the JOS PT. JOS PT is one of the good journals. It is in the top maybe 10 to 15 journals in physiotherapy field. Okay, very beautiful journal. So they gave a very good, management criteria, DICS risk factors. It was a very good comprised practice guidelines for us. So in our lecture series, we won't just be talk about what we made. A PPT बनाकर बोलना बहुत आसान काम है और उसको सुनना भी बहुत आसान काम है. The main tough fight is कि जब इस पूरे लेक्चर सीरीज के ड्यूरिंग में आपको पेपर्स भेजूंगा, नॉट मच बट लेस ओनली, ताकि आप उसको कोप अप कर पाए. पेपर्स पढ़ने के बाद यू विल रियलाइज कि इट इज मच मोर देन व्हाट आई स्पीक. Okay, so what relevant papers should we read? We will provide you that also. Keep in mind in that fact. Then how, when a patient comes with us with a pain like that, with a score of PRTE, we will talk about PRTE in the coming lectures. Okay, how we should approach it, how each step is gonna help us out. So now, why I was saying that patient education is a priority. So in 2002, Lancet. So Lancet is the second best journal of medicine. Okay, ये बहुत ही बड़ा जर्नल है. एंड इसने जब कॉर्टिकोस्टेरॉइड, फिजियोथेरेपी इंटरवेंशन और वेट एंड सी पॉलिसी को कंपेयर किया, he said that almost same gains were seen in wait and see group as compared to physiotherapy. Of course, physiotherapy was better than corticosteroid injection, definite. पर physiotherapy और जो हमारा वेट एंड सी पॉलिसी था वो भी बराबर ही था एट 1 year ऑफ फॉलो. तो अगर मैं इतना इलाज दे भी दूं घूम करके, पेशेंट को 1 साल या 2 साल के अंदर दिक्कत में आराम आ ही जाएगा. तो इट्स गुड, वी शुड help patient out with what the condition is actually. I hope that is clear with you. Exercise is a good idea, okay, in this tendinopathy. So it is a paper by Kernosis in 2020, I guess, 22, I guess, I don't remember exactly. So he told that load management and different mode exercise are the most popular treatment approach in lateral elbow tendinopathy. And the quality of evidence relates to effectiveness of exercise compared with other interventions has not been investigated. Okay. So क्या new है? Exercise performs better than corticosteroid. Exercise shows better outcomes than wait-and-see policy, of course. And no difference between concentric and eccentric. Eccentric exercise alone was found. तो saying people who say कि मतलब LET में हमें isometric करवानी चाहिए, eccentric करवानी चाहिए, concentric करवानी चाहिए, difference नहीं है ज़्यादा. Clinician should recommend advice of active intervention in upper limb strengthening and stretching as the first line of treatment. Okay, so this is how this whole paper was put up. So इसमें 30 trials हुए थे and two and 2, 3 subjects were taken. It is a very good paper and it told us that exercise is good. And then we talk about the corticosteroid. So I was fortunate enough to work over this paper and we found out like which is better, PTI or corticosteroid. And definitely बात है, it was a systematic review. It was published in 2022. So in PGI, I worked over this article and we found that, say no to corticosteroids. Simple. Corticosteroids should not be preferred in LET or in any tendinopathy, of course. And if any orthopedic surgeons comes to you and says that, steroid is the best for this condition, just show them any paper like this. And he will be like, yeah, ठीक है. And also you can guide the patients also. If they say, कि sir मुझे injection लगवाना है, मुझे ये सब नहीं करना है, you have to guide him or her. This condition will get worse if you go for corticosteroid. Short term benefit है, but long term में he will suffer. PRP, a new term, platelet plasma injections are there. They are also started in the literature recently. Evidence is low. Okay, I am not saying that it should be banned or it should not be done. फायदा देता है, but अभी बहुत ही कम ट्रायल हुआ है इसको. So can be considered if conservative phase, maybe in a month of 6 months to 1 year, अगर पेशेंट को रिलीफ नहीं आता है 1 year सॉरी, तो वी कैन कंसिडर दैट नो कि हाँ हम इस पे कोई और इंटरवेंशन दैट इज इंजेक्शन कैन बी प्रेफर्ड. And now the most important part where many myths will be busted, passive modalities. So deep friction transfixion massage के लिए कोई evidence नहीं है, shockwave के लिए कोई evidence नहीं है, counter brace के लिए कोई evidence as such नहीं है, questionable है but नहीं as such. TENS is not preferred, laser is not preferred, cryotherapy is not preferred, ultrasound is not preferred. Preferred is कि हाँ चलो taping is good, but taping इन्होंने बोला अच्छी है, बट इनको मैकेनिकली नहीं पता है कि कैसे टेपिंग से हेल्प होता है पेशेंट को. तो अगर पेशेंट को ही समझा पाएंगे हम तो क्या ही हो जाएगा. ठीक है. एंड टेपिंग से बेटर है द रिजिड टेप. सो इसका एविडेंस भी अवेलेबल है. ठीक है. मॉडरेट एविडेंस फॉर जॉइंट मोबिलाइजेशन. ओके, वी कैन डू दैट. मुलिगन ले लो या मे बी मिडलैंड समथिंग लाइक दैट. इट इज हेल्पफुल. So this is a very beautiful commentary which was by Bill Vincenzo. So Bill Vincenzo has worked his hell of life on this condition and he is retiring in a few months. So he gave a few exercises for this condition. So अगर ऐसे लोग जो इस चीज पे काम कर रहे हैं ये अपना कमेंट्री देना तो इट इज वेरी वैल्यूएबल. तो ये वाला जो एक्सपर्ट ओपिनियन है वो बहुत अच्छा है, पर यू शुड नो दैट कि वो ऑथर है कैसा. बिल विंसेंजो ने बहुत काम किया इस पे, सो ही इज अ क्रेडिबल पर्सन टू आस्क फॉर दिस कंडीशन. अगर वो कुछ लिख रहा है तो इट इज समथिंग. So as we all know, non-operative management of LET will result in successful resolution of symptoms in 90% of the patients. And the structure, the cellular, the chemical alterations in the tendon can exist in tendinopathy, but जरूरी नहीं है कि वो clinical presentation में भी आए. तो maybe some patients say कि मेरा tear हो गया है, मेरे MRI में आया था या मेरे अल्ट्रासाउंड में आया था. Doesn't matter, अगर patient ठीक है, so we don't care it. So this was about a condition called LET, tennis elbow, lateral tendinopathy. So I hope.
So Dr. Shivam, sorry to interrupting you. What a nice lecture by you. So you are saying according to the evidence, like if a patient come to us with a lateral elbow tendinopathy, so we immediately go to the ultrasound or shockwave therapy or cryotherapy. But as you have mentioned, according to the evidence, according to the literature, there is no particular effect on these passive modalities or electrotherapy. But from years we are practicing it, like maybe results